time. He has a clinical PhD in clinical and chemical pathology. He worked as a fellow in the National Cancer Institute in Cairo, Egypt. He was the chief medical officer of Al Borj in the GCC for the last 11 years. He was the former laboratory and blood bank director of the Saudi German Hospital. He's currently the medical director of Lab Diagnostic Laboratory in UAE, and introduced, and this is something that inshallah في ميزان حسنات الدكتور هشام, introduced the American Association of Clinical Chemistry to the Middle East with the team of Al Borj. And he will be talking to us about the logistics issue to consider to improve laboratory quality services. Dr. Hisham, floor is yours. Voice. We cannot hear you, Doctor.
Can you hear me now?
Yes, it's better.
Okay, so good evening, and thank you, Dr. Nashat, for the kind introduction. Thank you for the SSCC organizing and scientific committees. It's great to be here. And I'm going to speak to you today about logistic issues to consider to improve laboratory quality services. And the objectives, the presentation will address some quality issues related to specimen management and logistics. It will also suggest why new management approaches have become critically important, especially in Saudi Arabia. It will also overview examples of improved operations related to logistics and supply. So I would like to start by reading this quote by Marie Curie, which says, one never notices what has been done, one can only see what remains to be done. And I see this quote best describes the way laboratory professionals think and act. Laboratory professionals always try to find the missing piece more than celebrate what they have already achieved. And the reason why it is because we know how much physicians depend on our lab data in their medical decisions on a daily basis. And we are aware that lab results that we produce or our labs produce can have significant impact on patient care and outcomes. And hence the importance of quality laboratory services is indisputable. So when the physician orders a test, it activates a long series of processes that we are all aware of. Those are the three famous phases, starting from the prior to testing, the pre-analytic phase, going through the testing phase or the analytic phase, and finally to the reporting phase. And there are numerous processes that occur within each of those three phases of testing, and these are just some examples. You may agree with me that the most difficult phase to control is the pre-analytical phase. It is actually the most critical and the most vulnerable to errors. And I would like here to focus more on sample integrity, which is a part of the pre-analytic phase. So sample integrity, in the lab, everything starts with proper management of samples. And the quality of laboratory results is directly linked to the quality of sample collection and storage and shipping. It is crucial to the accuracy and reliability of testing and hence to the trust in the laboratory services that we provide. And that is why sample management is included in the essential elements of laboratory quality management systems. And as a part of process control, effective sample management means that the lab must always be proactive to ensure all samples that this lab receives meet the requirements needed to produce accurate test results. So the first major variable here is the transportation time. And transportation time is defined as the period between sample collection and arrival in the lab. And since the clock starts ticking immediately after the sample leaves the body, the goal here for optimal sample integrity is to minimize the transportation time. The second major variable to control during sample transportation is temperature. And depending on the measurement of interest, temperatures of storage and transportation vary, as you know, from ambient to refrigerated to frozen. And for labs specifically that service outreach testing, where couriers or delivery services are used to transport samples, all efforts must be implemented to provide controlled temperatures during transit. And failure to do so in a conscious and time-efficient manner may result in erroneous results, and that in turn may lead to incorrect treatment or delay in treatment or even misdiagnosis. So it is obvious that the transportation box is not just a box, it is actually a lifeline for someone who is in need. And so, in order to improve sample management and logistics, we would probably, or I guess it's a must, that we go through the following points and do a thorough analysis of those points or areas. Lab specimen handling and tracking end-to-end. Second, medical security for the data that are transmitted. Third is the chain of custody, especially in toxicology testing like drugs of abuse and other pre-employment testings, premarital checkups, and others. And finally, the laboratory supply, inventory, and delivery. And actually, an evaluation for quality deficiencies in these areas will have a reward to the lab. It will serve to improve lab end-to-end testing process. It will also reduce inaccuracies in testing that can impact length of hospital stay and, of course, laboratory costs. It will improve lab efficiency by minimizing repeat testing, which results in waste of personnel time, supplies, and reagents. And as a result, it will improve the overall confidence in laboratory testing and diagnosis and diagnostics. So, we know that our main competence, and Dr. Majda Shukdar already talked about the competencies. So our main competencies here and strength as well still lie within the comfort zone, which is the analytical phase. We try as much as we can to nail this phase, but we still have much to do when it comes to the pre-analytic phase. So how to fix the gap, or at least in the specimen management and logistics part. Well, in order to fix the gap, we have 2 points to cover. First, we need a dedicated, excellent courier service. And second, and most important, a highly sophisticated system of controls, monitors, and useful reports. So starting with the lab courier. And you know, the lab courier is probably the face of the lab, the first and last impression, who shows up at the client's office and usually is the primary personal contact between the client and the lab. And there's a popular wisdom that is the best courier solution is a courier department that is internally owned and operated by the lab or the hospital. And why? Because it gives the lab manager a sense of full control over the hiring and training of couriers, and also it gives flexibility to meet the needs of stat pickups, for example. So probably you know that there is a new courier service companies that are finding their ways to Saudi Arabia, and they probably are going to challenge this old theory. You know, they have much changed in the last decade, and now they offer robust and sophisticated capabilities that are much improved. over the capability of an internal courier solution. Those companies can actually because of the technologies and the advancements in the technologies and new software capabilities, those companies that have only one competence, they specialize in courier and logistics services. They can deliver an improved value proposition to the medical labs compared to the state of the industry or the current state of the industry as we know it right now. So IT has become a major force in reshaping organizations. The way the IT, the web, the internet, and the apps, they are miraculously enabling a new model of laboratory industry. Some even look at IT as the glue that holds organizations together. So some of the tools that already you know about, the mobile barcode readers, using those tools like they scan the samples and shipments upon pickup and also upon delivery to the lab. There is even a higher technology, the RFID. And you may think of it like, take everything you like about barcode tracking. You eliminate the problems of reading barcodes. What results is the promise of the radio frequency identification. And one reason to think of using it is its high potential to reduce medical errors and improve patient safety in a variety of ways. And one of them is the transportation. So also, the samples need to be effectively and securely tracked in a HIPAA-compliant fashion, or at least a fashion that is accepted by the country. Another technology is the GPS, and the advanced systems, they employ this global positioning system technology for tracking each specimen from customer to the lab. Also, the GPS technology allows the lab to analyze the route and sample pickup and drop-off times. Optimized routing improves the courier productivity and reduces the drive time. Also, some of those companies offer web portals to their clients, which is like an easy-to-use web portal to track, report, and manage shipments. It's a comprehensive cloud-based software solution designed specifically for medical laboratories to track and even do the route management and utilize barcodes using the GPS technology. Some even offer integration with the lab information system of their clients. And having this integration having this integration can have also many advantages, like it can offer several advantages, like giving the client the ability to manage the key logistic data. It can also provide the client with real-time detailed order specimen delivery reports. It can also send automated email notifications for supply and shipment reports and other advantages. So logistics is actually not an easy thing. It is a science in its own, and it is a complex issue. And using the logistics is not in the main competencies of the labs, at least the labs that we know nowadays. So in my opinion, there is a critical need that we think of new sample management approaches specifically in Saudi Arabia. And there are some reasons. First of them is actually not contained within Saudi. It is global, which is, Dr. Han already talked about it, the COVID-19 pandemic. And the COVID-19 created a wave of increased volume and risk in security, custody, and transit tracking of specimens. In some statistics, it immediately caused a 26% increase in requests for specimen deliveries and additional supply chain movement. A third reason is the wide geographic footprint of Saudi. It's a vast area, covers around 8% of the Asian continent with a land area of almost 2 million square kilometers. And there are lots of dots to be connected. A fourth reason is probably about the new Ministry of Health regulations. They allowed the independent labs to open collection sites. So they will widen their scope or their operations by having those collection sites. And those labs really need to think of how they are going to improve the collections and improve the transportation between those collection points. A fourth reason is that we already here in Saudi Arabia, as you all know, we have come a long way when it comes to improving qualities of the labs. We have almost all labs are accredited now by the National Sabahi accreditation. Many of the labs also have gone through accreditations from the international accreditations like College of American Pathologists, the ISO 15189 and others. And the teams from those accredited labs and their consultants may perform gap analysis, mock or real root cause analysis, or value stream mapping to arrive at specific process steps where improvement is needed to reduce those gaps. A fifth reason is the value proposition. You know, competition is really high now in the private sector. And because the public-private participation has become more mature, and we have seen this in COVID-19 pandemic, where there is a very good collaboration between the government and the private sector. And now, because of this high competition, you need to add value to your lab, away from pricing wars or the price wars. So driving or delivering added value to your clients can become a key differentiator for you if you want your lab to build market share and increase specimen volume. So having the right courier and logistics solution can really make the difference between financial success and failure here. So a question here, should labs consider outsourcing their courier and logistic needs? We always have thought of this as an integral part, but actually it is not in our core competencies. I don't know if you agree with me on this or no, but there is a change now in the whole world, and those major business organizational changes that already are taking place, especially in the last decade, the healthcare is not an exception for this. And we know that we cannot be skilled at all tasks. Maybe it is better if we focus on our core business skills and processes with outsourcing the non-core processes and procedures to outside organizations. Maybe this is a better way to grow. So also the notion of outsourcing will probably not seem so unusual to us. We already are outsourcing. Probably every single lab is sending part of its testings, especially the non-routine or the esoteric tests, to outside reference labs. This is called outsourcing. Also, almost all labs outsource the ongoing support for the LIS software to the vendor of this system. This is another kind of outsourcing, so it's not new to us. There are possible benefits of outsourcing. I would like to just give a brief of it. It will allow the labs to stay focused on their core strengths. It will also, or sometimes, it will maintain high quality patient care. It can assure accreditation standards. It can prevent errors that can lead to quality failures. And also, the competitive laboratories maximize efficiencies, increase their profitability, and decrease the costs when they leverage effective medical courier service that utilize digital technologies. So, in conclusion, the supply chain and logistic needs are highly complex. The virtualness and outsourcing, especially those enabled by IT, are important keys to success and growth in today's fast-moving business climate. And the clinical lab of today and tomorrow is highly dependent on IT and uses it to differentiate its information product offerings. By this, I end my talk, and thank you very much.
Thank you, Dr. Shah, for insightful. And and I
and
think
I think
you
you
have plenty
have
of
plenty
time for
of time for
questions.
questions.
MashaAllah, I
MashaAllah,
have
I have
prominent
prominent
the
the
time,
time.
so
So
I
I have
speakers
speakers
next,
next,
please.
please.
And
And
I promise you, what we do in the live conferences, we take a group picture. We will have a group picture, but this time virtual, with everybody. So, control, can we have them all together for questions? Thank you, thank you. So let's start. If I see the questions here, I would like to thank you first for sharing your expertise and your time with us in this the first virtual meeting for the Saudi Society for Clinical Chemistry. And we are to be honest with you, we are the first group to introduce, so we should be holding a pride for this one. A thumbs up. Just I listened to the talks, and I do have, I strongly believe that human capital is very important in the laboratory. Actually, they are the pillar of the laboratory, and how now we do have how about pre-analytical stage? Okay. We will see at the, I will read the question for you, and this is, I believe, addressed to Dr. Hisham. How spin after where we okay, how spending time after prayer, the ideal time affects in quality of specimen, and how this issue can be detected. I think that is like they are here asking about the
spending time of the specimen.
spending time of the specimen.
How is that? Probably this is a question for
probably this is a
technical. It's not logistical.
Technical. It's not logistical. It's about spending the time for PCR or to test. The question has to be clearer than this one. If I may ask the person who asked the question to rewrite it again. Okay. And here we have another question. The dedicated career only for the laboratory services is distant dream. Even it does not exist in US or UK. We must find solution in what we have. You need to suggest to those changes. Dr. Shamsa.
Explains what's going on. Yes, it is still a dream, but in the US it is now emerging, and you can see that there is already some of those companies that have started doing this job. Well, I cannot say some of the companies that already have started this business here in Saudi Arabia, and all are driven by the COVID-19 that has changed the shape of the healthcare. So we are going to see this soon, and I believe the Saudi Arabia with many of the technologists trying to find a way to get into the labs, all of these different models of businesses can open amazing chances for them. And I guess that there is a need that we improve this important part of our processes.
I believe if I understand the second question about the spending time
correctly, about the spending time, what's the effect of the spending time on the quality of the specimen when it is shipped between before and after spinning?
Difference. Go ahead. Okay, so spinning is out of the scope of my presentation, and again, it is different from a measurand to another. So following the guidelines is the right answer here.
By the time we receive another question, I would like to address a question myself to Dr. Shudar, knowing that Shudar, doing it right the first time, that saves a lot of time. So, what do you think, in your opinion, is the magic recipe for recruiting an excellent human capital? Mike, your mic. Did you hear the question?
Can you repeat it again? I know I heard Shogdar, but I didn't hear the question.
Okay, doctor. I say doing it right the first time, that saves you a lot of time. That's a proverb we know in quality. So, what is the magic recipe for recruiting an excellent human capital for tomorrow's or today's lab?
Okay, first of all, we have really to identify the real needs, not by position title, but the real need for the function. So the functional plan is the first thing. The second, I will quote this from Dr. Fluid Loop in 2004 when they asked him, and when I was working with them in one of the hospitals, they asked him what is the best recruitment process. He said, don't ever recruit supervisor who never been a frontliners. So I believe the frontliners who really knows the how, this is what we need. We don't need to have a lot of big position name or titles other than to know exactly what's expected from them to do. And I really do this in my work now.
Okay. And here is another question from the audience to you, doctor. Competency helps, but more than that, proper selection. Your suggestion for that?
I think there are many ways. I mean, now in recruitment and the selection, it has to be really not only reference check. We have to have, especially for our technical part, we have to have some kind of a professional assessment before recruitment. Honestly, I'm gonna talk about this shift career that I'm doing now, which is completely different from my work in the lab or in the healthcare. So I really now do something that's very good. I give everybody that he wants to work, I give him an assignment that I'm expecting him to be recruited for, and then after this I tell him that whether we can do this like something like an assignment to test him, or I can pay even for this one, but I give him a chance once, and then later on I decide. And to be honest, it's very successful, because some of the people, you just have a wonderful CV, but when it comes to the real life, it's better just to know them by phone.
Okay. Dr. Han, from your experience, what do you think would make PCR a good gold standard? What do the lab people need to develop to make it standard?
That's a good question. It's probably the most sensitive test that we have. The reason why I qualify the statement about the clinical gold standard is that when you look at the response to COVID-19, you can have a very robust epidemiology program, even with limited PCR testing resources. So you don't have to test everyone, although having wide-scale testing, I think, gives you a lot of data points. I think the recognition of what are the exceptions in cases in which they are COVID, but the false negative cases, I think that's the most critical issue. The other thing is that over time we've realized that the detection, the window period, seems to be quite fluid. So especially in over time we've realized that, and so there are cases in which, especially in contact tracing, you can catch different people in different PCR positivity or negativity depending on the time of your testing. So I would say that the window period, understanding the window period is important, especially if you're doing surveillance and contact tracing, and then recognize that in some classic cases of COVID, the virus has moved on from the nasopharynx. So we definitely have cases where the virus has gone either deeper into the respiratory tract, or it may move on to skin manifestations that is well documented in some of the skin registries. So the nasal pharyngeal swab tells you whether there's virus in the NP at that given point of time, but there may be other manifestations of COVID. And then when we look at chronic COVID, I think we're going to be in for some surprises along the way.
Thank you.
Thank you. Another question for Dr. Shuddar. From your own experience, what is the best way to mobilize the humans and get the most benefits from them?
I think number one is really employment, empowerment. We have to give them the trust, and to keep, especially for us as a technical people, we have to rotate. So there's not only one job that we have to do it, and this is part of actually of the the professional development plan I mentioned. So this rotation is really very important. The second, exactly to know the need assessment or the training need assessment for everyone as a person, not as a job. So in order to know exactly how I'm going to build their capacity, and I'm sure this will really impact on the retention and onto the to the competitive productivity, as I mentioned before. And this is from real experience.
Doctora, do you think that the recruitment is correct or right? We recruited the right person. And of course, you mentioned in your presentation that everybody works for the needs of money because money is a necessity. It's something that everybody needs it, especially nowadays. And what I say, how would you? I think the most difficult equation right now with the demands is less than what is offered in the market. How we will address the loyalty? The loyalty is very important aspects to the companies nowadays, and at the same time, that gives the stability or assurance to the employees or worker that they are why they should be loyal to a company or a firm that might, in a difficult time like the COVID situation right now, might lay them off. So how really we need to balance between those two concepts or two contradictory ideas?
Honestly, Dr. Nashat, I think there is one of the good things that we are using now in my current work, that we have to look for the abilities of the people, the skills, not necessarily to work on certain function. For example, now we fire people and then we recruit another people for another job, which can be done by those people who work in the same hospital or in the same organization. So it's part of the internal rotation that you can let people to, we have what we call it actually the internal rotation inside the organization. So we have a minimum requirements for this job that we can have it for those people who might lose their job. So instead of fire them, we have to give them the priority instead of get a new people who I'm going to pay more. That's why we said that they are intangible assets. If you hire somebody and spend on time and money in order for even 1 year or 2 years, and then you want to just get rid of him because you don't need him in the lab, what about the other opportunities? Maybe if we go for an automated lab, definitely we will have less manpower who are doing the hand test, but we need more people for the LIS and more for the automation and more for the others. But there are another jobs that we might need to recruit people for them and new people, but we have the organizational assets who already know the organization, who have already the generic skills and knowledge about this organization. So invest on them, give them a proper training to mobilize them for another position that they can be again productive. And this is absolutely will keep the people know that it's not easily to leave me go out.
Absolutely. I think that this is a new way of thinking of a cross-functionality of the workers in an organization. The organization already invested in these people. They know the culture of the organization. So why we don't maneuver them or mobilize them from a department to a department or from a group of functions to another group of functions and build on their skills and competencies? I think that's something that maybe we need to think of it in the difficult time right now, and at the same time prepare those organization or association like the licensing bodies that cross-functionality and now working and building on competencies is more important nowadays for the market demands rather than only the focusing on the certification and education. Maybe that's something happening into the future. And that will lead me to a point to Dr. Hisham. He mentioned about collection sites. And I'm happy and delighted now the MOH recognized the collection sites as a business, because before it's a mandate to have a lab in order to collect specimens. But do you think now there is a need, Doctor, for the training? How important to have the training on the class 6.2 of the dangerous goods, or the biohazard class by the WHO? It is another thing, another mandated, which cannot be offered by logistic companies, because still the shipper is responsible for this kind of specimen. What do you have any thoughts about it?
That's a very good question, Dr. Najat. And probably in this situation, probably there's going to be a responsibility for the medical director to either add those competencies to the company that is outsourcing this, that is being taking care of this job, or probably will keep it for his staff or for her staff. But I believe that those, like you said, the collection sites is a real challenge now for the regulations and also for the accreditations like Sabahi and the other international accrediting bodies. But specifically Sabahi, I guess they already are doing an excellent job to standardize the operations inside the labs. But here is another challenge that probably the standards were not focusing on, because the decision from the Ministry of Health to allow those labs to have those multiple collection sites is very new. It's very recent. It's, I guess, has started just before the COVID pandemic, so it's like 6 or 7 months from now. And I am expecting that Sabahi are going to add more pressure on this specific point.
Okay, and for the sake of time, I will take the last question, and it is addressed to Dr. Han from the audience. While PCR does not make always good tests, if not selected in time and space calculation, what test do you suggest in follow-up for COVID patients?
Very good question. PCR is a good test. It's not perfect, and usually I think in most settings, the paradigm is basically the lab involvement with the hospital in stratifying patients. It's basically a population health kind of strata. So you have the asymptomatic patient, the mildly symptomatic patients, the moderate ones, and then the very symptomatic that may ICU. So really, there are different paradigms and algorithms. It's going to depend on your setting, what the resources are in your setting, because a positive PCR with the different degree of symptoms, you're going to approach that patient very differently. And so that's how I would approach it, using your PCR plus the clinical findings and population health type of framework.
Thank you very much, Doctor.
Thank you very much, Doctor.
I think
we will take a picture while you say all thumbs up.
Okay.
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 Great, thank you.
Great, thank you.
By the end, I would like
my speakers, Dr. Majid Jafar, Dr. Anil Han, and Dr. Hisham Shams for a wonderful session, and I wish all the audience a successful meeting. Thank you again.
Thank you, everybody. Thank you. Assalamu alaikum.